Welcome to the Dental OSCE Podcast.
In this episode of the Dental OSCE Podcast, we dive into the management of safeguarding in dentistry. Safeguarding is one of the most important topics in LDS exams. Thank you for tuning into this podcast, where we simulate clinical scenarios to help you refine your communication and decision-making skills. In this episode, we'll focus on the management of safeguarding, providing the right way, how to approach safeguarding OSCEs in LDS exam. Before we get into the scenario, you will be listening to a small class on safeguarding and its relevance to dentistry in the UK. Introduction. Safeguarding is the process of protecting children, young people, and vulnerable adults from harm, abuse, or neglect. In the UK, safeguarding is a legal and ethical responsibility for all healthcare professionals, including dentists. As dental professionals, we are often in a unique position to identify signs of abuse or neglect during routine interactions with patients.
Why safeguarding is relevant to dentistry. Frequent contact with patients. Dentists frequently interact with children and vulnerable adults during dental checkups and treatments. This regular contact provides an opportunity to observe signs of abuse or neglect, such as poor oral hygiene, unexplained injuries around the face or mouth, delayed presentation for dental or medical care, oral health and overall well-being. Oral health is often linked to general well-being. Neglect in oral care might reflect broader issues of neglect in other aspects of life. Dentists can play a pivotal role in identifying these issues early. Duty of care. Dentists have a duty of care not just for the dental health of their patients, but also for their overall safety and well-being. This includes acting when there are safeguarding concerns.
Key UK laws and regulations on safeguarding. Children Act 1989 and 2004 places a duty on healthcare professionals to promote the welfare of children and protect them from harm. Defines categories of harm, including neglect, physical, emotional, and sexual abuse. Working together to safeguard children. 2018 sets statutory guidelines for professionals working with children to ensure a coordinated approach to safeguarding. The CARE Act 2014 focuses on safeguarding vulnerable adults, including those with disabilities or those unable to protect themselves from harm or neglect. Equality Act 2010 ensures non-discrimination and protects individuals from harm, particularly those from vulnerable groups. Local safeguarding boards. Multi-agency partnerships that investigate and manage safeguarding issues at the community level.
General Dental Council, GDC, principles related to safeguarding. The GDC standards for the dental team highlight safeguarding responsibilities under several key principles. Principle 1. Put patients' interests first. Dentists must act in the best interest of patients, including protecting them from harm and ensuring their safety. Principle 6. Work with colleagues in a way that is in patients' best interests. Dentists should collaborate with safeguarding leads, healthcare professionals, and local safeguarding boards when concerns arise. Principle 7. Maintain, develop, and work within your professional knowledge and skills. Dentists are required to stay informed about safeguarding procedures, signs of abuse or neglect, and local referral processes. Principle 8. Raise concerns if patients are at risk. Dentists must act promptly if they suspect a patient is at risk of abuse or neglect, ensuring appropriate referrals to safeguarding authorities.
Practical steps in safeguarding for dentists. Recognize. Identify signs of neglect, abuse, or harm during dental examinations and patient interactions. Common indicators: unexplained bruises or injuries around the mouth or face, delayed development of a child's dentition, persistent neglect of oral hygiene. Record: document findings in clinical notes accurately, including observations, patient or parent statements, and any actions taken. Report: raise concerns with the practice safeguarding lead or directly refer to local safeguarding boards. Dentists can also consult the GDC or local authorities for guidance. Refer: contact local safeguarding boards or services as necessary, ensuring the patient's confidentiality and dignity are preserved. Case study. Podcast description. This scenario is designed to assess the ability of a dentist to identify safeguarding concerns during a routine dental visit. The dentist begins by addressing the child's dental issues, but uncovers deeper concerns about the family situation, including neglect and financial struggles. The examinee must empathize, navigate the conversation to bring out the safeguarding issues, and make appropriate referrals.
Scenario introduction. A 7-year-old boy, Jack, is brought to the clinic by his mother, Mrs. Smith, for complaints of toothache and difficulty chewing. Jack presents with multiple carious teeth, poor oral hygiene, and an anxious demeanour. The mother seems stressed and avoids detailed answers. The task is to explore the situation, identify safeguarding concerns, and refer appropriately while reassuring the mother.
Good morning, Mrs. Smith. It's nice to meet you and Jack today. Jack, how are you feeling?
My tooth hurts, especially when I eat.
I'm sorry to hear that, Jack. Don't worry. We'll take a look and see how we can make it better. Mrs. Smith, could I ask how long Jack has been experiencing this pain?
Oh, it's been on and off for a few weeks. I thought it might go away, but it hasn't. The pain is in his upper jaw and I think he might have some few cavities.
Thank you for letting me know. I'll examine Jack's teeth shortly, but first, could I ask a few questions about his dental habits? For example, how often does Jack brush his teeth?
Usually once a day. Sometimes he forgets if we're in a rush.
I understand. Mornings can be hectic. What about his last dental visit?
It's been a while. I don't really remember when we last came.
No problem. We'll make sure Jack gets the care he needs today. Before I continue, I'd like to quickly check Jack's medical history. Does Jack have any medical conditions or allergies I should know about?
No, none that I'm aware of.
That's good to hear. Does Jack have any siblings?
Yes, he has a younger sister. She's 4.
That's lovely. Does everyone live at home with you?
Yes, it's just me, Jack, and his sister right now.
The dentist examines Jack's mouth and observes multiple decayed teeth, significant plaque buildup, and inflamed gums. There are signs of prolonged neglect.
Mrs. Smith, thank you for your patience. I can see that Jack has several cavities and his gums are a bit inflamed. These problems usually develop over time, and I'm concerned about his overall oral health. I'd like to ask a bit more about your current situation so we can figure out how to best help Jack. Is that okay?
What do you mean? I'm doing my best for him.
Of course, Mrs. Smith. I can see you care for Jack, and I'm here to support you. I just want to understand if there's anything happening at home that might make it difficult to keep up with Jack's dental care.
I'm going through a divorce. It's been hard. Managing everything on my own is overwhelming.
I'm really sorry to hear that, Mrs. Smith. That sounds incredibly difficult. Are you receiving any support, either from family or friends?
Not really, it's just me with the kids. Their dad doesn't help much.
That must feel like a lot of pressure on you. Can I ask, how are you managing financially?
Mum, it's tough. Sometimes I have to choose between paying bills and buying other things.
Sometimes, when we see dental issues like this, it's a sign that families might need additional help. Part of my role is to look out for children's overall well-being. I'd like to involve our clinic's safeguarding lead and local safeguarding board to see what resources we can connect you with. This could include support for Jack's dental care, financial advice, or even help managing things at home.
No, I don't want them to take my kids away.
I completely understand why you might feel that way, but I want to reassure you. Safeguarding is about support, not punishment. The safeguarding team is there to help families, not separate them. You've already taken an important step by bringing Jack here today.
I don't know. It's just so overwhelming.
I hear you, Mrs. Smith. You're doing your best in a very tough situation. I'll make the referral today, and the safeguarding lead will contact you soon. They'll work with you to create a plan that makes things easier for you and better for Jack. You're not alone in this.
Okay, thank you.
You're welcome, Mrs. Smith. Let's work together to make sure Jack gets the care and support he needs.
Key actions in the scenario. Initial focus. The dentist begins by addressing dental issues and collecting information on brushing habits, dental history, and general medical history. Uncovering concerns. Gradually explores living arrangements, financial situation, and the mother support network. Identifying safeguarding needs. Links dental neglect to potential broader safeguarding concerns. Reassurance and referral. Reassures the mother that safeguarding is supportive, not punitive, and makes a referral to the safeguarding lead and local safeguarding board.
Conclusion. Thank you for taking the time to listen to this podcast on safeguarding and its relevance to dentistry in the UK. Safeguarding is not just a legal obligation, but also an essential part of providing holistic, patient-centred care. As dental professionals, we have the unique opportunity to identify and act on safeguarding concerns, ensuring the well-being of our most vulnerable patients. Remember, safeguarding is not about blame. It's about support, protection, and collaboration. By recognising the signs, documenting accurately, and referring appropriately, we can make a meaningful difference in the lives of children and vulnerable adults. If you found this episode helpful, feel free to share it with colleagues or revisit it whenever you need a refresher. Together, let's continue to uphold the principles of the GDC and provide compassionate, high-quality care. Thank you for listening, and until next time, take care and stay vigilant.